Hi folks, Canadian Prepper here. So one of the things I've always worried about with regards to a grid down situation is how I'm going to manage pain if I have to go under the knife. So imagine, the grid's down and you need a tooth pulled, or maybe it's something as simple as, you need a wound sutured, or heaven forbid, minor, major surgery, you have to go under the knife. Maybe you need a limb amputated or something really severe like that. Well, guess what? You're not going to be privy to all of the medication that we take for granted nowadays that would make that procedure more manageable. So today on the channel, I brought my friend over, Dr. Joe Altons, to talk about how a person can prepare themselves for a situation like that, where you may need to treat pain, you may need anesthetic in order to get through one of those gruelingly painful medical procedures. What are you going to do when help is not coming? Now, if you don't know, Dr. Joe Alton and his wife, Amy Alton, who's a nurse practitioner, are the authors of the Survival Medicine Handbook. This is probably the first book that every prepper should have in their library. It's far more comprehensive than your typical first aid books, which are basically geared towards helping you keep somebody stabilized until help arrives. Well, the whole premise of this book is that help may not be coming in one of those long-term disaster scenarios. Therefore, you may have to take matters into your own hands. So check out the link in the description to add this book to your library, or at least put it on your wish list for later, because this is definitely something you're going to want. Now, if you do have medical questions that you would like the doctor to answer on this channel, feel free to post those in the comment section, and we'll see if we can bring them on for another video to address either the questions that pertain to the contents of this video or just medical questions in general. Without further ado, let's get to the video.
I'm Joe Alton, MD, a retired but actively licensed medical doctor and fellow of both the American College of Surgeons and the American College of OBGYN. I'm also a member of the Wilderness Medical Society, and I'm certified as an advanced wilderness expedition provider. For the last decade or so, I've focused on medical preparedness for disaster scenarios and any other setting that takes away access to modern medicine. Together with my wife, Amy Alton, an advanced registered nurse practitioner and certified nurse midwife, I'm the founder of the survival medicine website, doomandbloom.net, the Dr. Bones Nurse Amy YouTube channel, and the Survival Medicine Hour podcast. As for our books, we're the New York Times and Amazon best-selling authors of several, including the Book Excellence Award winner in medicine, the Survival Medicine Handbook, the essential guide for when medical help is not on the way, now in its third edition, 700 pages. Plus the new book, Altons Antibiotics and Infectious Disease, the layman's guide to available antibacterials in austere settings, all about infectious diseases and the antibiotics that you can obtain that cure them. Also, we have written the New York Times bestseller in 2014, the Ebola Survival Handbook, also the Zika Virus Handbook, and a number of others. I'm also a contributor to magazines like Survivor's Edge, American Survival Guide, and Backwoods Home, as well as the designer of an entire line of medical kits at store.doomandbloom.net. Our mission? To put a medically prepared person in every family for any disaster, and to prevent the deaths that might be avoidable in catastrophes. Just about anything you do in survival settings may put you in need of pain relief. Just think of the activities of daily survival that you don't have to perform today. Try lugging a 5-gallon bucket full of water from the nearest water source to your camp, chopping wood for fuel, bending your back to weed that vegetable garden, which could mean the difference between starvation and full bellies for your loved ones. Even if you're young and athletic, you're always at risk for injury or just aches and pains from exertions you're just not accustomed to doing. That doesn't mean that your body can't perform these activities. Researchers found that adults who engaged in an hour of high-intensity training experienced a significant increase in adrenaline and endorphins, feel-good hormones, that are compared with those who engage in less demanding physical activity. This helps in situations where heroic efforts might save a life. It doesn't mean, however, that you won't pay for it afterwards. An anesthetic is a substance that induces insensitivity to pain, usually in the form of an injectable drug, a topical cream or ointment, or as a gas you inhale before surgical procedures. It may or may not involve the loss of awareness depending on the substance used. An analgesic is a substance that relieves pain, usually given as an oral medication, but it can be injectable as well. It can be very strong or not so much. Ibuprofen is a typical example of an analgesic drug, but then again, so is morphine. Local anesthetics cause a loss of sensation in a limited area, usually soft tissue, that allows a procedure to be performed that ordinarily would be painful. Awareness is usually not affected with local anesthesia. Lidocaine, with or without epinephrine, would be an example of a drug that, when injected into soft tissue, induces local anesthesia. Global, also known as general anesthetics, affect the entire body and usually induce a loss of consciousness and a certain level of amnesia. They can be administered via inhalation or by injection. Many compounds have been used for inhalation anesthesia, but only a few are still in widespread use. Isoflurane and others in that family are probably the most widely used today, usually combined with oxygen and nitrous oxide. Ketamine, propofol, and fentanyl are examples of injectable inducers of general anesthesia. Often these injectables are given first, and then isoflurane or a related drug used to maintain the anesthetic state. I don't have to say that some of these drugs have been abused. Drugs like fentanyl accounted for a large number of opioid-related deaths every year in the United States over the last few years. Last year, as a matter of fact, enough fentanyl made its way into this country to overdose every man, woman, and child. I would think the one that I would recommend most is ibuprofen 200 milligrams. It's probably the most popular pain reliever, anti-inflammatory, and fever reducer that you'll find on the market, and can be taken in either 200, 400, 600, or 800 milligram doses. This medication is useful for so many different problems that it's especially useful, I think, as a stockpile item. It can alleviate pain and inflammation from strains, sprains, arthritis, traumatic injury. Gosh, ibuprofen is useful in reducing fevers from infections. I would say that a wise maximum dosage per 24 hours would be 2,400 milligrams a day, no more than that, because the downside to ibuprofen is that it can cause stomach upset, especially if taken in higher amounts. Then there's acetaminophen, 325 milligrams, also called Tylenol in the US at least, another popular pain reliever and fever reducer. It can be used for all of the problems that you can take ibuprofen for, with the added benefit of not causing stomach irritation or thinning the blood. Unfortunately, it has no significant anti-inflammatory effect. This drug is excellent, however, for the treatment of pain and fevers, especially in kids, at lower doses. Tylenol comes in regular, extra strength, and extended release. Adults take acetaminophen or Tylenol 1 to 2 every 4 hours or 1 to 2 every 6 hours at higher doses. Then, of course, there's aspirin, 325 milligrams. If you have ibuprofen and acetaminophen in your medical storage, why consider aspirin? Well, aspirin has been around since the late 19th century as a pain reliever, fever reducer, and anti-inflammatory. But it has blood-thinning properties as well. As a matter of fact, it might be all we have to help those with medical issues that require the use of anticoagulants, like, say, Coumadin. It's also useful to treat older folks with coronary artery disease. If you suspect someone of having a heart attack, have them chew an adult aspirin immediately. The ingredient in the original aspirin, known as salicin, can also be obtained by chewing on a strip of the underbark of a willow, aspen, or poplar tree. If you have aspirin, take 2 for pain, fever, and inflammation every 4 to 6 hours, no more than 12 a day, and watch for stomach upset, something that occurs not uncommonly at higher doses. Now, how about alcohol? Alcohol has only a mild depressant effect on the central nervous system, but it would be very useful for pain management in situations where there is just no other type of analgesia or anesthesia available. This is not because it eliminates the pain, it just decreases the likelihood that you'll remember it. What, if any, are good natural alternatives to manage pain? People are always asking where they can obtain injectable local anesthetics like lidocaine, or even how to make the acetone and bleach formula known as chloroform. These are both Items that would have the desired effect of causing anesthesia, of course, but they have pretty significant risks as well. Chloroform was used all the way back in the Civil War, dripping it into a cloth held over the patient's face. The problem is that it caused burns on the face, and the issues with dosing were so unclear that some soldiers died from the anesthesia itself. Lidocaine is known to most as a local anesthetic agent, and it is when it's injected into soft tissue. But accidentally injected into a vein or an artery, it acts as a heart drug, where it's actually used to treat bad heart arrhythmias. The problem is if you inject it into a vein or artery of someone without an irregular heartbeat, it makes it irregular. It can give you convulsions, and it can even cause cardiac arrest. Go to drugs.com for a more complete list of the possible complications. That's why it's a prescription drug. So what about natural options? It depends on the kind of pain that you have. Clinical trials suggest that the cannabinoids in marijuana are effective in relieving pain caused by multiple sclerosis and some neurological injuries or illnesses. Of course, in the absence of a functioning modern medical system, some will consider growing plants that produce opiates. Instead, consider kratom, a plant in the coffee family that produces pain relief in certain amounts, but isn't an opiate. The FDA tried to make kratom illegal, but outrage from thousands of users who claim it eliminated their dependence on opioids caused the FDA to reevaluate its stance. It's still controversial, but you can see dozens of testimonials on its use on YouTube. Other herbs that have a sedative effect, like valerian root, are thought to have some effect on discomfort. Another one is clove bud oil. Clove bud oil is an excellent dental anesthetic. Ginger extract may help with joint and muscle pain. Feverfew has been used for centuries to treat headaches, stomach aches, and toothaches. It's also used for migraines and rheumatoid arthritis. Turmeric spice has been used to relieve arthritis pain and heartburn and to reduce inflammation. Ginseng has been used for fibromyalgia, kava kava for tension headaches and neuropathic pain, St. John's wort for sciatica, arthritis, and neuropathic pain, capsaicin for relief of a lot of different types of pain. Just because all of these items are natural, however, doesn't mean that they might not have adverse effects. Your experience may vary. Also, the hard scientific data is still not there with regards to many of the substances I just mentioned. Do your own research and come to your own conclusions. There are a number of therapies that don't involve either conventional or natural remedies that might help pain. One is acupuncture. Acupuncturists place tiny thin needles into your skin. The location of the insertion is supposed to be related to the source of the pain. Although, interestingly enough, it's often not right where you're experiencing the pain. Acupuncture may relieve pain by causing the body to release serotonin, a feel-good chemical that eases discomfort. If you're athletic at all, you probably use heat or cold to deal with pain from injuries or overexertion. Heat therapy works by improving circulation and blood flow to a particular area due to increased temperature. Increasing the temperature of the afflicted area even slightly can soothe discomfort and increase muscle flexibility. Heat therapy can relax and soothe muscles and heal damaged tissue. There are two different types: dry heat using heating pads or packs, and moist heat using moist packs, steam towels, or hot baths. Both types of heat therapy should aim for warm as the ideal temperature instead of hot. Moist heat seems to work best for me. Modern heat therapy treatments from an ultrasound, for example, can be used to help certain types of pain. If the area in question is either bruised or swollen, however, it may be better to use cold therapy. Heat therapy also shouldn't be applied to an area with an open wound. Cold therapy is also known as cryotherapy. It works by reducing blood flow to a particular area, which can significantly reduce inflammation and swelling that causes discomfort, especially around a joint or a tendon. It can temporarily reduce nerve activity, which can also relieve pain, and using ice may give a very short-term local anesthesia. There are a number of different ways to apply cold therapy to an affected area. Treatment options include ice packs, frozen gel packs, coolant sprays like ethyl chloride, ice baths, and more. These treatments are popular but may be problematic in those with nerve damage, such as severe diabetics, or any condition that prevents a patient from feeling when too much heat or too much cold has been applied. Thanks, Canadian Prepper, for having me on your channel to talk about medical issues in times of trouble. Check out our website at doomandbloom.net for over 1,000 free articles, podcasts, and videos on medical preparedness. You can follow us on Twitter at Prepper Show, YouTube at Dr. Bones, Dr. Bones, Nurse Amy channel, and on blogtalkradio.com for our podcast, The Survival Medicine Hour. You'll also find an entire line of medical kits and supplies for the uncertain future, as well as our books, at store.doomandbloom.net. Thanks again.
The best way to support this YouTube channel is to support yourself by gearing up through CanadianPreparedness.com or BugoutRoll.ca. Premium quality gear at the best possible price using the incredibly secure and easy to use Shopify platform. We offer free shipping to the United States for orders over $200 USD and free shipping to Canada over $75. So support the channel by supporting yourself.